Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I have a familiar face, Dr. Susan Creech, dentist extraordinaire is what I call her. You've seen her before. She's amazingly progressive in the things she does. And you know, if you saw my podcast from a year or two ago, we did salivary testing. Now she's taken it a step further with another salivary test that checks for more that I just did. I spit in a little tube and then mixed it up, and we're going to send it off. And in 4 days, I'm going to have my results. Tell me, Susan, about the difference in this test. Just first of all, just tell me kind of what this does.
Okay. So the salivary testing that I'm doing now compared to what I was doing before, it just tests for more. It tests for more bacteria. It tests for yeast. It tests for viruses.
Okay.
And so it's just more thorough, gives you a better snapshot of what is going on in your mouth. So for me, it's a map for diagnosis. You know, it's giving me more information than I'm going to get just visually looking in your mouth, and can treat you more personalized.
The last time that we did this salivary test, it's interesting because I came positive for 2 out of the 5, I think, and 2 or 3, and you treated me for it. And my mouth got a lot better because at that time I was having a whole lot of problems with my mouth, with different ulcerations and things like that. But it really did help my mouth a lot. Mm-hmm. So now we've got this new one that you had called me about. I really want to hear about this. What else does it check for?
So it will show more of the bacteria, especially the one that I'm most excited about is the bacteria that contributes to implant failure, because more patients are getting implants now, and there is a particular bacteria that gets into the crevices of the implant, can get in and around the bone, and it actually cause inflammation and cause the implant to fail. So that's one of the big ones. Wow. That I'm
really
excited.
Interested in that because a good friend of mine has had that happen recently.
Mm-hmm. Okay.
Spent a ton of money on implants, and they're not doing too well. And I bet you, it just makes me wonder if somebody should get this checked before they get the implant.
So I'm telling my patients when they're going to get implants, or if they've just had them, let's test you. Let's just make sure that we can rule out that there is not, a competing factor in your mouth that is going to, risk the safety of this implant and the health of the implant long term.
That is really interesting because, like I always tell people, your mouth is a gateway to your digestive system, and the bacteria in your mouth can seed your heart with bacteria.
Right.
And all this other stuff that we never even think about doing. It's so proactive. So what else besides all these bacteria does it check for?
So we're testing also for bacteria that causes cavities. So Streptococcus mutans is probably something some people have heard of. If there's a high level of S. mutans, then it allows me to be able to say, okay, you've got a high level of this bacteria. Why don't we get you on a good regimen of oral hygiene, like brushing, flossing, but in addition to that, we can also do some fluoride, we can do hydroxyapatite, we can put it in trays, have you wear the trays so that that material sits against the tooth and can help you, reverse or not get cavities. Also with cavities, we really want to be talking about diet. Like, are we drinking sodas? Even Gatorade, Propel, kids are chugging that stuff because they're playing so many sports, but it is terrible for your teeth. It puts holes in your teeth. So,
no doubt about that. I'm glad you mentioned that hydroxyapatite, which you use as an option to fluoride. We've talked about fluoride in the past and how controversial it is, but that is a good option, it sounds like, for maybe if you don't want fluoride.
Right. Yeah, and and in the news, we're seeing more about fluoride and the effects, negative effects, and so I see patients every day in my practice that are asking about hydroxyapatite now. So it's becoming a lot more popular.
I love that you're open to that because most dentists that I know just say, no, it's BS, just going to keep doing it. But
right.
I mean, the longer we live, the more we learn, and it's that doctors tend to have this thing called cognitive dissonance that I talk about all the time in my practice. That's the way they learned it 30 years ago. That's the way we're going to do it.
Right.
They're not open to new findings that certain things we did wrong in the past. So
yeah, and just the difference is you just listen to your patients. I mean, like really, what are they interested in doing for their health? And at the end of the day, it's the patient's decision on what they're going to do. And so I just need to be able to offer everything that's available and let the patient decide what's going to fit them the best in their health.
I'm 100% in agreement with that.
Yep.
It's their decision. We're working for them, really.
Right.
So what else does this thing check for?
It also tests for yeast. And yeast and bacteria, when they combine, they make plaque more severe. So we want to know if a patient has yeast in their mouth or high levels of yeast. If they do, there's a couple of natural things that I might recommend. The kombucha tea, because of the acetic acid and the polyphenols. And then also we can prescribe medications like nystatin, antifungals for yeast as well.
Do the mouthwashes work for that? Do you use rinses for nystatin rinses and that type of thing?
It depends. If it's all over the mouth, yes, that's a great option. If it is in a particular area, you can get a trochee and just let it melt on the area.
A lot of times when we do stool testing for intestinal yeast, we treat it systemically. So it might be something that if it's in your mouth, it's maybe in your intestines. I don't know. So. Right. There may be a good systemic treatment too.
And have you heard of Miracle Mouthwash? Okay, so Miracle Mouthwash is a mouthwash that can have a percentage of different ingredients in it, and nystatin is always one of the ingredients I'm going to put in Miracle Mouthwash.
Always in there.
Also, our new salivary test is testing for viruses as well. There's 4 viruses that it tests for: herpes simplex virus 1 and 2, Epstein-Barr virus, and cytomegalovirus.
So now you have an option for people to get fever blisters to really test and see if they're a candidate for treatment early. Yeah. That's a great thing.
Yeah. So with the herpes simplex virus, it's a virus that's going to lie dormant in the body. And so the only way that the test is going to show a positive result is if it's an active infection. And and I've had situations where a patient tests positive for it, and they'll say, well, I haven't had a cold sore on my mouth or my lips. And I'll say, okay, so it's probably coming, and we can go ahead and prescribe, a acyclovir medication, an antiviral for it, so that the cold sore isn't as bad.
Or be a short duration.
Yeah, right.
I know in my practice, if they get a fever blister, I always have a prescription on hand for them to start the treatment as soon as they feel it or coming
tingle,
out. So you're saying you could do this even before you even get any symptoms.
Right.
That's awesome.
Right.
That is awesome. Yeah. So what else are we testing for?
Well, let's see. We are testing for the bacteria that's going to cause periodontal disease to grow, to get worse, to cause bone loss and tooth loss. Periodontal disease, it is one of the most undiagnosed diseases and has like a huge impact on the whole body. We talked about before how like 90% of the population has periodontal disease, and they don't even know it because it's asymptomatic until it's not. And then when it's not, it's quite bad, and you're already having bone loss and talking about losing teeth or having teeth that you have to undergo surgery for periodontal disease. And it spreads. Periodontal disease definitely spreads. It starts in the mouth, but it doesn't just stay there. You swallow it. It gets into your circulatory system. It can affect your heart. 95% of those with diabetes have gum disease. 95%. 50% of heart attacks and strokes are triggered by oral bacteria.
50%. Now that's incredible.
And this oral bacteria that we're testing for is the bacteria that's been correlated to the bacteria that's found in those that have heart attacks and strokes.
Strep viridans comes to mind from past knowledge, but it's interesting because a couple weeks ago I had a patient in the hospital, septic. They couldn't figure out why this lady was septic. It was from her mouth. She had an abscess that was asymptomatic, and she got septic, almost died from it.
Wow.
If somebody hadn't looked in her mouth.
Wow.
That was a couple weeks ago.
Right. So that's, the importance of just having your x-rays taken on a routine basis, because many of the abscesses that people get, it's in the bone. You don't see it until the immune system just can't handle it anymore. Our immune systems are wonderful things, but it can only take so much.
Exactly. You can overwhelm it.
Mm-hmm.
So
Yeah.
this test that you do routinely, if people ask for it, it's not something you do on every patient,
Correct.
but it's available.
Mm-hmm.
I know it helped me out in this thing. I'm really interested in knowing the results of this thing. Any
Yeah.
other words of wisdom about this test? Who should get it?
Well, I wanted to ask you about something that you probably test for, HSCRP.
Yeah.
Can you tell me a little bit about that? And I'll tell you what I've learned about it through the salivary testing.
It's highly sensitive C-reactive protein. It's a marker of inflammation that I check on everybody that gets a Cleveland. So if that's high, you've got some inflammation in your body. The thing about it, you can't really tell where it's coming from a lot of times.
So how that would relate to a salivary test is if you have that marker and it's high, and your doctor's saying, why is it high? Do a salivary test and you can see bacteria that may be at a high level. You take antibiotics, you take probiotics, and then retest and see if that marker for inflammation doesn't go down.
In the meantime, a red flag goes up, I need to take care of my teeth better.
Correct.
Through flossing. And you have a special kind of rinse that you gave me one time. Stella, what's it called?
Stella Life.
Stella Life. I thought that was awesome.
So Stella Life, I've been going to continuing education, and every time I go to a course and they're talking about what you need for implants, what you need to take care of your mouth for periodontal disease. Stella Life is coming up every time. It's becoming very popular. I'm actually starting to carry it in my office.
Wonderful.
Because I want patients off of Listerines and scopes. I want
why is
them
that?
off of those antiseptics, antimicrobials, and bacterials, because long-term use of those has actually shown that it kills the good bacteria that we need.
That is so interesting.
Yeah.
I've never been a fan of those two.
Yeah. And there's actually a class action lawsuit with Listerine that you should look up and just see about it. But it's so strong and damaging to the mouth and to the bacteria, killing off the good bacteria, that it's allowing for a very for an unbalanced system of bacteria in our mouth.
So you recommend probiotics for
I do.
everybody. What's your favorite probiotic for your mouth?
So I like Probiora Pro because there's 3 of the bacteria that you really want in it, and it contains all 3 of them.
This is I'm learning a ton.
And you need to
this.
take a Probiora Pro or a probiotic specifically for the mouth, because you can do probiotics for the gut,
right.
but specifically for the mouth daily.
Interesting. So you can almost map your microbiome out in the mouth, just kind of like we do the stool testing for the intestines. That is amazing. Any other great points on this thing? I can't wait to see this.
I think that testing your saliva, it's great that we get these results and we can personalize your treatment, but I also think it helps patients really to be more dedicated to their oral health. It just, when they know what is in their body, then and if there is something that they need to work on, they're just more dedicated to doing it because they've actually seen a result. And we're not just guessing. You might have this bacteria because your gums are swollen. You do have this bacteria, and that is why you have periodontal disease.
I used to think that when they said, you need your mouth clean, by dental hygienists every 6 months, I'd go, why every 6 months? My teeth are fine.
Right.
But the older I get, the more I learn that is so important. I'd probably get them cleaned more often than that if I could.
Yeah, and that's driven by insurance, of course. And it's one of the most, I do not understand why dental insurance would only allow 2 cleanings a year. And of course a patient can have more if they choose to pay for it out of pocket. But, when you have a disease, the bacteria is oftentimes resistant to scaling or debridement that a hygienist is going to do. And the only way to kill the bacteria is to supplement it with probiotics and antibiotics. And so, patients that are willing to have more cleanings per year are going to have a healthier mouth. It's like exercise. Would you run twice a year and expect for your body to be healthy?
No. How often would you ideally say an adult should get their teeth cleaned?
4 times a year.
4 times
Every
a year?
3 months.
That's interesting. I'm going to switch to that for sure. Well, any other words of wisdom? You're so progressive and so interesting, so knowledgeable about all this stuff. It just blows me away, really. I've never heard a lot of this stuff before.
Yeah. I just the periodontal salivary testing has been a really nice addition to the practice. Patients are just more interested in their health. They appreciate being able to know a little more about their bacteria in their mouth, and it just has given me a healthier practice.
Well, you do a fantastic job.
Thank
Dr.
you.
Susan Creech, thank you so much for coming in today, and we'll continue this dialogue. You get something new, or just occasionally to remind people how important your mouth and your teeth are, please listen to Dr. Susan Creech. Thank you. We'll see you guys next week.